most of our disorders, especially the genetic disorders, have not been amenable to treatment. At best, we have been able to extend quality of life and survival for short periods. But we really are ushering in a new world where we are genetically modifying outcomes and providing therapies in these areas of rare inherited muscle diseases. It couldn't be a more exciting time. For the young folks, this is a great time to be in neuromuscular medicine. And in neurology in general, because just about every area of neurology is seeing major and rapid advances in therapeutics, and we really are impacting in a positive way the lives of our patients. My name is Ali Habib. I'm Associate Professor of Neurology at the University of California, Irvine in sunny Southern California. It's been a really fun last few years in the field of myasthenia in particular. We've always had good and effective treatments in myasthenia for several decades, but this new era that has been ushered in since the mid-2010s has really revolutionized therapeutic approach to myasthenia. And we're only looking to move forward and make bigger strides in the therapeutic landscape in myasthenia. So again, it's been a really big era of development and advancement in rare disease, neuromuscular space, rare disease, neurology space, and neurology in general. I think the science is finally catching up to diseases, and we're really getting not only a better understanding of the mechanisms involved in disease, but actually being able to address some of these mechanisms, target some of these mechanisms. Perhaps the most exciting part is being able to target genetic disorders in neuromuscular diseases as well as other areas of medicine because of technological advances, and that really is a very exciting time. To be able to have therapies for very debilitating diseases as well as fatal diseases, it's phenomenal. There are so many, and every day we are touched with the stories of our patients. I would recount one of my recent patients who was having significant problems with his myasthenia. His myasthenia particularly affected his speech and swallowing, and that was impacting his work capabilities and performance. And he was having tremendous difficulty with swallowing, to the point that he had actually lost about 80 pounds. And this had been going on for several months before we were able to finally get him on the appropriate therapy. And with that, it was such a dramatic turnaround. This first follow-up visit that he came to, he gave a detailed account of all the ways in which his disease had improved. He was back to eating normally. He had already gained back some of the weight that he had lost. And his wife, who was on the phone, was in tears because I remember her saying, "You've given me my husband back." And those were very powerful words, and they touch you deep. To have that kind of an impact on a patient and their families' lives is tremendous.